Yeah, hi, this is Bruce Crispin again, and I think this is a simple question. I've been doing reconstructions for probably over 50 years now, and getting a good interocclusal registration is really the key. And if it's not repeatable, you probably don't have an accurate one. And usually it's not accurate because either the muscles or maybe you got some tooth interferences that are deviating the mandible from whatever position you want to get your interocclusal registration in. But one of the biggest problems really is just muscles that are kind of used to biting a certain way, and maybe you want to position the mandible in a little different position, and the muscles kind of tense up. They're used to dodging interferences and so forth, or used to going into an old centric occlusion. And so the QuickSplint really is just a very quick way to fabricate a deprogramming, which just relaxes the muscles. And again, if you can get relaxed muscles, you can get what I call mandibular control. And without mandibular control, you can't get an interocclusal registration that you want to dictate. Okay, if you want them to just bite together and use their centric occlusion that they have, that's one thing. But if you want to dictate a centric occlusion, maybe you're building a case in centric ablation and opening the vertical possibly, then you need to have good relaxed muscles so you can get repeatable interocclusal registrations. And getting good, accurate, repeatable interocclusal registrations is really a critical component when you're doing advanced cases. And this is really what we teach in our Advanced Fix prosthodontic residency program here at Aesthetic Professionals, is that interocclusal registration is critical.
You know, when it comes to locating an orthopedically stable and repeatable bite position, we have to understand something. We have to really understand opening and closing. So if you're old enough, like I am, you were taught that the first motion of opening is a hinge. Well, that's simply not true. If you think about it, what muscle opens our mouth? And that's the lateral pterygoid. So the lateral pterygoid has to contract, so we get both a hinging and a translation at the same time. Now, if there's a posterior interference present, then there's going to be even more of a forward shift as your mandible is trying to get past that interference. What the QuickSplint does for us is by disengaging the posterior teeth, right? There's no muscle, elevator muscle activity playing this, tug of war between CRCO and MIP. This also allows the lateral pterygoid, since it's not pulling the mandible away from an interference, to relax, and thus that allows us to find an orthopedically stable position, and that's why it acts as a deprogrammer.
Hi, Dr. Mike Smith from Biting Education and Clinical Mastery Series. The question is, can you explain why it's difficult to take repeatable bite records on some patients, and why does using QuickSplint as a deprogrammer correct this? Well, it all has to do with muscle engram memory of where their bite is. It also has to do with inflammation. So as the patient has these engrams that are telling the jaw to, hey, hit this way or you're gonna break something, it really helps to reprogram those memory engrams in the proprioceptive response to get it so that patient can have a good feeling of bringing their teeth back together without having that hit slide, that protective response. The QuickSplint also helps to decrease the inflammation in the joint space and gets the muscles to settle back down because you're decreasing the force, the activation of those muscles to allow them to calm back down, get the muscle engrams right, get the inflammation correct, and it really helps to deprogram these patients to get so you can get an accurate, repeatable, reproducible bite record to rebuild your cases or to do your diagnostic records to find out what you need to do. Fantastic deprogrammer, and it's very easy because you make it chairside, only takes 45 to 55 seconds, and they're good to go.